Hello, my name is Heather Knox. I'm the Chief Executive here in NHS Lanarkshire. I'd like to talk with you today firstly about where we're at in terms of the pandemic and the number of patients we have in our acute wards, and secondly I'm going to talk a bit about our delivery of the vaccination programme. So first of all, in terms of this third wave of COVID, the good news is that the daily number of new cases is now beginning to slow down. I think we had 233 new cases today in Lanarkshire, so that is slightly down from where we have been. I'd like to see it coming down faster, but pleased that it is on a downward trajectory. Our inpatient numbers are currently around 330 today, and they've been up as high as nearly 350, so that's around 100 more than we saw at the peak of the last wave. So it has been a struggle to make sure that we have enough beds and enough workforce to look after these patients. What I would like to say is I'm really pleased with the way the whole system has responded, and our community colleagues have worked very flexibly and moved across into acute roles, and our acute colleagues equally, a lot of them have moved from their traditional roles, maybe in theatres, doing elective work, to move across into looking after COVID patients. So I'd really just firstly like to say thank you to all those staff who are working in a different environment just now, and thank you for your flexibility, and that's helped us to cope. Secondly, I'd like to just say a bit about our delivery of the vaccination programme. I think last week I talked about where we were at with the first wave of that, which is clearly people who are living in care homes and the staff who look after them, and the over 80s. And I'm pleased to say we're on track to deliver our vaccination programme to those cohorts by the end of the first week of February, which was our original plan. And secondly, we'll then move into the next cohorts as we move through February, and again we've recruited all the workforce and we're busily training people to vaccinate at the moment, and again that's going really well. And you might have seen some of the information about some of the vaccination sites. That's available on our web pages if people want to look at where their closest vaccination delivery site is. And we're having help and support from the Army in the logistics of setting up those centres. As ever, I'd just like to end by thanking everybody for all the work that they're doing to support patients during this difficult time. Thank you very much.